Hi, my name's Jill. I'm a physical therapist. I've been practicing for 4 years. I currently work in primarily the geriatric population in assisted living facilities and independent living facilities.
What state are you in?
Florida.
Florida. How did you first hear about ETPS therapy?
I got one of the little postcards in the mail that said eliminate chronic pain, and I thought, well, that's one thing in my practice that I really have had the most problems with. So I decided, why not go ahead and learn some more about it.
Where did you first take the course?
I took the course in Kissimmee, Florida.
And actually, as we speak, you're in training at our intermediate course. How are you liking the course so far?
It's great. Originally coming into the course, I was really nervous. I wasn't sure as far as, I took the original course in January, and I wasn't sure as far as my practice in between, how I was doing. And when I came here, I've really just felt that it's all come together. I'm realizing not only where the points are, but as far as diagnosing, and then going from there and making my own judgment points rather than reading out of a book and going through the points that are already given to me.
How has the therapy been working for you in your practice?
It's amazing. I have people coming in that have had chronic pain forever, and they say, well, it's kind of, they come to me and they say, all right, well, if you think you can do something, it's kind of like I almost have to convince them or prove to them that I'm not just trying to, get them on my caseload, that I really feel like I can do something for them. And I've had women 80 years old that have had hip replacements for 10 years, and they're able to go back in the pool and swim and walk on a daily basis. They work in the store nearby, and they credit it to me. It's not really me, of course, it's the ETPS that I've used on them.
How has it changed your practice? What are some things that you can do now that you couldn't do previous to taking the training?
Well, I really feel more confident that when I treat these people, that when I tell them that we will really work through their pain, that I feel like I'm really telling them the truth, that it's not just, we'll try it. It's that I really feel like I can get to it and I can really get these results. So it's really helped with my confidence building. As well as I used to just kind of look as a physical therapist, I looked at the muscle weakness and the balance problems. The first thing I always go to now is, well, if you have pain and problems with the sacrum, the gait's not completely straight, that's always the first thing you look at, and then everything else kind of falls into place.
Can you think of any examples of some patients that you've treated over this past year where you've received dramatic results?
Probably the biggest one is an 80-year-old woman that I just mentioned. She had a hip replacement a couple years ago, it was about 10 years ago, and she's a very active, very cognitively intact, very active woman, and she wasn't able to do all of the things that she should have been able to do. And she wanted to do simple things, like just be able to get up in the morning and get her coffee without having pain and things like that. And now she's out doing aquatic exercise on a daily basis, gets up at 6 o'clock and then goes in the pool, works at the store next to the facility that we work at. And it's just amazing to me, and she's really doing a lot better. And spiritually and her attitude, she just has so much more energy, and she walks much better, which is, of course, wonderful.
So would you recommend this therapy to other therapists?
Absolutely. In fact, I took the course in January, and since then I was one of the first therapists in our clinic to go and get the first course, and since then all of the therapists in the clinic have been to the first course. So I'm the first one to come to the intermediate course, so hopefully others will follow also.
Thanks, Jill.
Thank you.